Good morning. Today is part 5, and we are going to talk about when systems fragment. One of the things I've learned from sitting on both sides of healthcare is that most people don't realize how much coordination happens behind the scenes until it doesn't. As nurses, providers, and patients, we're often looking at the same situation from different perspectives. And most people who enter healthcare genuinely want to help. Yet even with good intentions, systems can become so divided that communication gets lost, information gets delayed, and patients are left carrying the burden of connecting those pieces themselves. And when you're healthy, managing appointments, referrals, records, and follow-up calls can feel tedious and inconvenient. But when you're sick, exhausted, in pain, or struggling cognitively, those same tasks can become completely overwhelming. Patients can begin to feel lost, unheard, and left carrying the weight of coordinating their own care at a time when they are least able to do so. This isn't about blaming individual providers. In many cases, the people providing care are working incredibly hard. It's about what happens when the system around them becomes fragmented, making it difficult for anyone to see the full picture. At its heart, this is a call for greater continuity, communication, and humanity in healthcare. Every patient deserves more than a collection of appointments, test results, and specialist visits. Every patient deserves to be seen as a whole human being. This is part 5, when systems fragment. There's a particular kind of exhaustion that comes not just from illness, but from navigating a system that feels divided into disconnected pieces. One specialist addresses a body part, another reviews a scan, another responds days later through a portal. But no one seems to see the whole person sitting in front of them. There is a human being there. Even when they are hurting, even when they are falling apart in ways that no one can see. When care becomes fragmented, patients can silently fall through the spaces in between. What begins as a search for answers becomes a cycle of retelling, re-explaining, and hoping and praying that someone will eventually connect the dots. Over time, that hope begins to run out, and it quietly erodes what's left inside. As a nurse, I once worked within these systems and I believed in them. As a patient, I now experience them differently. I have felt how isolating it can be when communication breaks down and that continuity disappears. When systems fragment, so does trust. And when trust erodes, people lose not only time, but hope. And I share this not to criticize individuals, but to call for reflection. Healthcare is strongest when it is coordinated, compassionate, and whole. I invite our North Texas community once again to pray for wisdom, for those leading our institutions, for clarity and courage among providers, and for meaningful reform that restores continuity, dignity, and humanity to patient care. And I pray that that spreads beyond our North Texas community as well. I also invite our community and our nurses to start standing up for those who cannot, because at some point, every single one of us or someone we love will need to depend on that system working as it should. We need to remember the human in healthcare. Just a nurse writing from a patient's chair. Thank you for listening, and we'll see you again tomorrow.